over the years, one of the talks I've struggled with has been the barren mare talk. I've always found that a slightly tedious talk to give, really. So I wondered a couple of years ago if I could put a sort of slightly different spin on talking about barren mares. And so I came up with this. Endometrosis is quite well, I'm going to tell you what it is, so we don't need to know. It's been a highly problematical condition, and it's one of the few treatments, or few conditions, I should say, that there's something a little bit new on its treatment. So you won't see too many mares with endometrosis, so we'll go fairly quickly through this. But I thought we'd just talk about it in terms of how you deal with a barren mare or a mare with a problem. Well, you know, is endometrosis, does it mean that the end of the career for that mare? Well, I think when you get asked to talk about something, I've begun this sort of tactic of I almost try and evaluate what it is they're meaning by that. What does that question mean? Is endometrosis career ending? Well, we can't answer that unless we know what endometrosis is. And endometrosis is defined as a degenerative chronic process by scar tissue in the lining of the uterus. And it used to be called chronic degenerative endometritis. And at a symposium way back in '93, a wonderful veterinarian, sadly no longer with us, Bob Kenny, decided we'd call this condition endometrosis. And we diagnose it by, we can't scan mares for endometrosis. Do you know how we diagnose it? We diagnose it with a biopsy. I don't know. How many, do you take many biopsies here, or?
Yeah, our problem is, yes.
I'm a little bit in two minds. I do biopsy these mares, but this is I like this lecture because I make some assumptions about breeders, so it would be a good chance for me to, I'm not rude about them, but I make some judgments or assessments about them, so you can tell me if I'm wrong, but this is what I think. Biopsy, I think, is a useful technique, certainly for assessing the degree of endometrosis, and allows you some degree of objectivity into how severe the problems are. So I probably don't take as many biopsies as some colleagues, but I think certainly they have got a place. So we have to understand what any disease process is if we're going to decide it's the end of the line for that mare. As a veterinarian, I don't feel we can make that call unless we know what the condition is. So if we're talking about endometrosis being career ending, what does that mean? And of course, the interesting thing is, what does career ending mean? Now for you guys, it's the end of that mare carrying a foal to term. But of course, for all the sports horse breeders, that isn't career ending for them. They've got a heap of options to do. You know, for the thoroughbred mare, it means she's not going to carry any more foals to term. That's what career ending is. But that isn't necessarily career ending for a sports horse mare. And whenever you're in practice, you know, all of us have clients who have different levels of money, the same as different vets have different amounts of money. I wasn't driven by money, but I do like rich things, I guess, so I need my smart car and a smart boat. But it's the same for some clients. Some clients will spend money on mares, others won't. That's what I've found. And I've never quite worked out in the client's mind why all of a sudden sometimes they'll decide to stop. But I'll come back to that. So that's a mare with a prepubic tendon rupture. Now, the foal she's carrying is going to be the last foal for a thoroughbred mare that she'll ever have, because people have looked at putting mesh in there, they've looked at trying to repair that. But I think it's over. You can't ask that mare. I mean, we've got to look, we'll be very lucky to get the foal she's carrying out alive. But she's certain, we can't put her back in foal because it's unethical, really. It's not on. But if she's a sports horse, she's a dressage mare or a show jumping mare, not a problem. You know, even in our little practice, we'll do 40, 50 embryo transfers a year quite easily. And I'm a big fan of even oocyte collection. I look after sort of these days some polo ponies which will normally use embryo transfer in polo ponies, and then when they get to a certain age, bang, we just cannot get embryos off them anymore. It's not that we can't do it, because we're using the same stallion we're using the same techniques, we do plenty of embryo transfers. If the embryos were there, we would get them. They just stop producing embryos. So we take the oocyte out of those mares instead, the actual egg out of the follicle. We put in a little bit of medium, and we make a transfer of that oocyte into the oviduct of the recipient mare. And I've already taken the oocyte of that recipient mare out, because we just go ahead and breed that recipient. It's not IVF. That's something that'll never, well, it is commercially available, but it's not going to come into an ordinary practice. We try and do oocyte collection in our practice, probably only 2 or 3 a year. And this is a point I was meaning before, really. I think some clients suddenly decide they're going to stop breeding from the mare, and I don't know what makes them come to that decision. I presume money at the end of the day, or frustration, or can't go through the whole thing again. The difficulty is, of course, most diseases that prevents mares going in foal aren't a black and white issue, because a mare with endometrosis in the uterus is likely to have other problems. She's likely to accumulate fluid as well. She'll have other things going on. And I've always thought that you know, when I've worked with breeders across the world, they have a wide range. Some people will persist with mares, and others will pack up with them and retire it. And I'm not convinced. Yeah, money may be involved quite a lot, but I'm not convinced it's only money related. Why is it you basically decide to stop with a mare, give up with a mare?
Because all mares sometimes produce foals that the conformation isn't so good.
Yes, that's the argument. And I know some. It's a particular feeling. If we'll get time to talk a little bit about placentitis, and we can be quite aggressive with treating placentitis. But there's some very good veterinarians who say, bugger it, leave it. I'm not going to mess around with treating that mare, because whatever, it's going to be a runty thing of a foal. So I'd sooner, if she's going to go on and abort, let her abort, and we'll clean her up and start again. And yet other people will spend, the treatment can be £100, pounds, so 1,500 rand a day for maybe a month to keep these placentitis mares in foal. And the question is it worth it? So that might be the same. If you do all this messing around with these mares, is their uterus really just not able to carry a foal? So even if we get them to have a foal through to term, is it any good? So yeah, that's a reason I hadn't thought of, really. That might be. So you would actually stop with a mare something and say, that's a finish, it's over, we're not having another go.
And it's also pressure from your employer. So why do you keep breeding with a mare that's not conceiving?
Yeah. Which then I suppose that, if they look at it logically, really, why would you do it?
Look at it as money.
Yeah, I think money must be at the bottom of a lot of it. But what about some very rich owners who suddenly decide? But then to some extent then, I mean, in that situation, are those guys going to listen to a biopsy? They're really just going to keep trying and keep trying. And that's, I've always kind of struggled with that, really.
There seems to be the common belief in the sales room that if you have an old-based foal, it's less valuable or less likely to be a high-class racehorse. Can you support, or can you?
Well, people have looked at that, and I think it would be safe to say, well, that the jury's a little bit mixed on that, really. I think it was Twink did some work actually looking at uterine environment, and he couldn't really find that the older mare had a worse uterine environment, but other people have disagreed with that. So I don't really know. Do you have a feeling as breeders that there's...
That's what happens at the cells. If you've got a mare of about 18, you get less for the foals, even if they...
Yes, I mean, and that's an interesting thing, and clearly you've noticed that at sales, so it must be right. But of course, people have looked at, I know it's the Northern Hemisphere, but people have looked at racing performance of foals born, and it doesn't actually correlate particularly with when they're born in relation to the year. I mean, January foals don't actually race, in the studies that have been done, statistically any better than foals born, I can't remember whether it's as late as April, May, but it may even be May. But of course they don't sell as well. But the evidence for that, and it's no good in that, having the evidence, because the industry doesn't work on that. They're not going to listen to it. And I think it's a little bit with when people stop breeding. So endometriosis does cause, what I think the second biggest reason for a mare ending a career is trauma at Dystocia. I think it's riving mares around. What do you do with Dystocias here? It must be quite a unique approach to them, is it really? Or? Yeah, no, I wasn't. I would hope you did. We're big fans on I'm very, very fussy with the Dystocias to time them, and it's the one, I normally let all the vets who work with us, they can pretty much do their own thing, but one of the rules we have in our practice is that each of the different techniques you're going to use to relieve the Dystocia, you have 10 or 15 minutes. I mean, we vary a bit. I almost think 10 minutes to deliver the foal. By an assisted vaginal delivery. We break Dystocia down in the veterinary world now, and some of you will know it, I guess, is to an assisted vaginal delivery is where the mare, you may sedate her, but basically the mare is fully conscious, and you put ropes or chains on whatever there is, and you try and deliver that foal. That's what we call an assisted vaginal delivery. If that doesn't work, if you're not making any progress with that, you can then move to what we would call a controlled vaginal delivery, where you anesthetize the mare. Now, this mare here is undergoing a controlled vaginal delivery at Angus. This is Angus McKinnon. They're quite a famous Australian repro vet. This is in at the clinic at Angus's, and he's doing a controlled vaginal delivery, because the mare's not going to play any part in this now. The mare's anaesthetized, you've hoisted her up, he's going to try and deliver it. Now, you can try a controlled vaginal delivery on a stud farm if they've got the facilities to deal with it. There's no point anesthetizing them on a stud farm if they haven't got anywhere, say with a big beam and a block and tackle, they can lift the hindquarters up. So, is it done much over here where they'd knock the mare out on farm and try and deliver the foal? You see, of course, it's very different for you guys who are quite experienced. We did that with our stud. If our 2 or 3 of our biggest public stud managers said, well, I've had a feel of this, the foal's doing X or Y, there ain't no point me going out to see it because I'm not going to deliver it. They probably deliver more than me, so they would come straight in. When I talk to guys who do more breeding work for one-off owners, the tendency is that they'll go out and try and have a go at delivering it, I guess. Is it? Yeah. Yeah, I think it's quite a high incidence, is Dystocia. I think it can be nearly as high as 10%, and most for us in the UK is an abnormal presentation. The foal just isn't coming the right way, really. Yeah, we make them time them for 10 minutes. I gave this at a meeting with some quite experienced veterinary colleagues, and they maybe felt I was being a little bit light with 10 minutes. They would possibly try for 15. But my feeling is to back yourself. If I can't deliver it by pulling in 50, if I think I've lined everything up and I'm pulling for 10, 15 minutes, it's not coming out, it's over for that. It's plan B time, because there's no point running the risk of damaging the mare. I personally don't think. It's plan B time, which maybe we can discuss what that is. It may be doing it on farm, but it's a big thing to anaesthetize a mare on. Boy, you better deliver the foal then, because you've gone out, we say we've gone out the frying pan into the fire. If you've anaesthetized that mare on farm, then you bugger around for 15 minutes and can't get it out, then you are buggered. So that is a tricky one to get out of. Yeah. So I think I would persuade them, and it sounds like you guys are very keen to do so because you see the benefit of it. And to me, it's a no-brainer. But the one-off person, or the person who maybe, perhaps a non-thoroughbred breeder it's the first foal, they don't seem to get that. And, then the faffing around, they won't have a transport, they won't have this, and la-di-da. And they put a pressure on you. And if you're not, it doesn't matter to me. I'll just say, no, this is what we're doing. But I think there's a big tendency, if you're less experienced, you'll carry on. I've heard of people trying to deliver foals for an hour. And that's madness. It's madness. I do. Good. Yeah, I need you. Yeah, it's a funny. Yeah, it's a good contrast. This I got. I got a little bit. The vast majority, 80% of the veterinarians at this meeting we were at in January would be sports horse veterinarians. Would be veterinarians who look after people who maybe have. This is the first foal they've had, and they don't get that so much. I don't think they would. They'd have problems loaded. They wouldn't know where to go. They wouldn't have a trailer. They wouldn't have a float. They moan about this. Yeah. No, I think it's very much a difference you had. And I stress this really. It's the preservation of future fertility of the mare. I think that gets forgotten in Dystocia. And it's an area that I have, it's very, very difficult. I mean, how do you get the young vets that come to you, Ian, how do you get them Dystocia experience? What do you do? It's phenomenally difficult. If I'm physically around, or the two senior guys in our practice, we would go. We would make them come with us because they could do some of the donkey work, but we would take them with us to try and get them some experience, because I think it's very, very difficult. In some things, in veterinary medicine, a lame horse or a sick horse, you've got you can, if it's not going quite right, you can do something else tomorrow or something. The difficulty we have here, and I love my climbing analogies, if we're climbing quite a serious mountain and we're putting our crampons on, if they fall off, we're helicoptered off the mountain, it's over. That decision, and you have to do it fast because your hands are frozen, and you have to get it right. And I think some decisions we make in the breeding world, well, we have a chance to correct them or do something about them if we weren't quite right, or la-di-da. But you don't with a Dystocia. And, a lot of times, we were pretty much a busy stud practice. And when these sports horse people would ring at 3 in the night, they sounded surprised. That, when you sort of say, hello, oh God, John, were you in bed or were you asleep? And I mean, I think those folks think we're sat in a car waiting for you to call us with the engine running. It's amazing. Well, we're not going to do that on the off chance someone falls with a Dystocia. And, for us in February, March, I have to wait 5 minutes for the windscreen to defrost, So it's one of those funny things, Dystocia. So I've slightly sidetracked anyway, but broodmares to end a career, I think reproductive trauma is quite a way up there in my experience. Other things would be orthopedic, and then these are, you know, older mare issues, really. And this is a great thing I get. If ever, you know, some veterinarians in the UK say, oh no, John, you shouldn't get anyone. You know, we tell people to tell us what's going on. You know, even we run these foaling courses for the less experienced breeders, the first time breeders. And I always tell them, I say, right, if this appears at the vulva, you must rupture that. Simple as. Unless the veterinarian is going to be there within 10 minutes, tops. That foal only has 5 minutes to survive because it's lost. This red bag delivery, what that means is that the placenta internally has just separated away, and it should have ruptured here. You see where that black arrow is? It should have ruptured there, and the foal comes out. So it hasn't ruptured. So that's the other thing you've got to tell the client, is that it won't be easy to rupture. Now this is rare. Have any of you had a red bag delivery? I guess you might have in you know, you have to be, you know, been in breeding a fair while. Well, or you could be, someone has to have one rarely, I suppose. Now, what else can be red and velvety and sticking out of the vulva of a mare? What do you think that is? That's the bladder. But I don't think you'll ever get, and I hesitate to say, if you rupture the bladder in these, don't come and find me. I don't think a bladder will prolapse in a prepartum mare. I've had 3 cases of ruptured bladder postpartum, so the mare's foaled. I just physically don't think, and I've never come across anyone having seen a case of a ruptured bladder before foaling. So if a client rings me up and says there's a red velvety thing sticking out of the vulva of the mare, I tell them to rupture it. And I'm waiting for the call, and they tell me the bladder's gone. Yeah. Yeah, so that would be that could be, I should have done that really. Yeah, actually that's a good point. Yeah. I should have checked them. Yeah, I actually think you're right. I think that probably is the foal's leg there. And of course, you know, if you're going to decide something's career ending, you have to understand what the treatment is. And as I said to you at the start, endometriosis used to be a more miss than hit treatment. It was more a disaster than any sort of success. People have tried scraping it, they put DMSO in, they put kerosene in. But we've recently got a successful treatment. This is in the last 2 or 3 years. So you've just got to keep your eyes open as breeders and vets for new advances. And this is something that I think is very exciting. It's a Brazilian treatment. I've left these in. Sorry, this is a very good friend of mine who, you won't know, but his research is stem cells. So back in England, I always put this slide up and I say, why have I got a talk? He's a top musculoskeletal and lameness specialist veterinarian. So I asked him, why have I got a picture of him up here? And it's because we're going to use stem cells. Stem cells, the jury's a bit out on treating tendon injuries with stem cells. And I was talking about it a little bit with, I think, some of the vets who look after the horses up in training in Joburg. And it seems, from what I can gather, that you guys are more into IRAP over here then, which you could argue that IRAP is a kind of stem cell therapy if you wanted to look at it in one way. But anyway, the straightforward injection of stem cells in tendons, I think it would be safe to say, hasn't really taken off particularly. Don't worry about that, I don't really understand it myself. That's how stem cells exert their effect. And what we've wondered is how to deliver the stem cells to the uterus. And 2 papers, one in 2013, used an artificial insemination technique. And the technique I like is injecting them through the biopsy channel of an endoscope. And this is some stem cells getting put into the uterus of a mare with endometriosis via an endoscope. And it was only done last year. So, well, it was done the year before. Then the mares were bred. And I haven't seen the data published for whether more mares have carried a live foal to term. So endometriosis may just be something that's of interest for you. I can't. I normally put this file up, but it doesn't apply here, of course, because we had wine at lunchtime. So I can't do it really. We'll probably just going to finish because I really want to finish on time.
Can I ask you a question?
Yeah, of course you can. I can multitask while I'm getting this ready.
I heard at lunchtime something, but I always give my mares Finidine after they fold, after birth is out. And somebody here said that it thins the blood and then you can get bleeding in there.
Well, there is a little bit of, I mean, people always say you shouldn't put a twitch on a mare post-foaling because they seem more prone to hemorrhage. Touch wood, I've never seen it. If I'm called to remove a placenta, I'm quite fussy to try and get it removed. I don't know about the teaching in South Africa, but the teaching in the UK has gone a little bit telling students to not remove the placenta. But I always do make quite an effort to remove the placenta, and I'll quite often give them a shot of oxytocin. And I will give them a shot of Finidine as well, because I think they're just very uncomfortable. I think it makes them uncomfortable. And I think they get less colic, and I've not seen a problem with it.
I've never had a problem with somebody.
I don't know if anyone's had someone had a problem with Finidine, or? Right, well, I thought if we're just... So, a little bit about placentitis to finish off, really. Guys, it's the most common cause of late pregnancy failure. Remember, we're not talking about embryonic loss now. We've moved into, I suppose, abortion, we'd call it, really. And remember, we artificially make 40 days, the cutoff for that. I mean, you know, so we're talking about loss of the pregnancy, certainly post 40 days, but really it's going to be, most placentitis abortion is often in the last trimester. I mean, certainly 6 months onwards. And I did check with the vets I talked to when we were organising this, when somebody said to talk about placentitis, that you get the same placentitis we do, which is an ascending infection through the cervix. America gets quite a specific placentitis called nocardia placentitis, but from what the vets told me, we don't seem to get that over here. You get the same placentitis we do, which is a creeping forward through from the vulva through the vagina up into the cervix, and then it sets up sufficient cervix infection to go on into the uterus. So that's why we use that term, ascending infection via the cervix. It's a little bit as with most reproductive disease, I suppose, or certainly bacterial diseases in the mare. It's this mixed population. It can be the strep zoo epidemic is very common in the mare, a gram positive, or the E. coli, which is a gram negative. So we've always got to be mindful of that when we're treating a placentitis, certainly at the outset before we've found exactly what bacteria is involved. And certain mares we can put as high risk for placentitis. They would be older mares, mares which have aborted in the past, mares which have a poor vulval conformation. Now, the difficulty is that if you wait, you've got to be... Too many people, when the mare gets to 5, 6, 7 months, they don't look at it very carefully. And if you wait before calling a veterinarian till your mare is like that, it almost certainly is over. What you've got to do is pick up when there's just a little bit of dried infection on the tailhead or a little speck at the vulva. If you wait till the mare's holing out pus like that, well, it's not going to work. And you'll know the other signs, other development, premature lactation, dilation of the cervix. You may not have any of them though, of course. And what we do is, of course, we'll take a swab or smear from that. And these days we use quite a lot of, I've got less interest in transabdominal ultrasound. It's much easier as well to do transrectal ultrasound. We use the same ultrasound machine that we use for the routine gynae assessment. And we measure the placental thickness there. Is that getting done on mares here? And it's relatively straightforward to do. You try and measure it as close to the cervix as you can, obviously, because that's going to be the port of entry of the infection. And you don't measure it on the dorsal, the top part of the uterus. You measure it on this ventral part of the uterus, as close to the cervix as you can. And we've gone on more for that than using the transabdominal ultrasound. But look at all these things you can do to assess the fetus there. Measure fetal heart rate, aorta diameter. So there is an awful lot on late-term pregnancy monitoring with abdominal ultrasound, but I just don't really want to get too much into it today. As a practice, we use it. It's one of those things we use more, and now we use it less. Most of the time, we go for assessing with a transrectal ultrasound. We used Sonocyte Micromax machines which have a variable frequency, 5 to 10 megahertz, and we measure that combined utero-placental thickness. You can't split up the endometrium from the allantochorion. Remember, in a foal, the white membrane is that glistening white one quite closely attached to the foal itself. That is the amnion. When you see the red bag or the waters break, what is happening there is it's the release of the allantoic fluid. The allantochorion is the outer membrane, the one that gets retained, and that's the one tightly applied to the endometrium. So that's what you're measuring. And we can assess the placenta. We can assess what the fluid is looking like. We generally like to see the fluid fairly black, fairly anechoic on scan. We don't like lots of particles in it. And just a technique we sometimes use, it won't happen for you guys because you'll have controlled things mainly, is just occasionally somebody buys a mare at an unknown stage of gestation and they want us to age the pregnancy. And from about 5 months on, the only way to age it with any sort of accuracy, and even that is a little bit suspect, is we measure the fetal orbit, the eyeball diameter. So we try and do it, don't worry about all the detail on it, we try and measure it as close to the cervix as you can, and we generally take 2 or 3 dimensions on there, and we don't remember these images, but those of you who've seen it done, I'm sure this was the image you would end up with. Here you can see a placenta thickness, and I measured it there, 1.1 centimeters. We don't, we've gone off remembering piece of information. We used to laminate cars with this or have it somewhere as a reference. As a general rule, in most thoroughbreds, you don't want to be seeing a placenta much over 1 centimeter in thickness. If it's much over 1 centimeter, there's a good likelihood you'll have a degree of placentitis there. And we generally take average measurements, and because there's always this degree of edema, this swelling dorsally, never try and measure it at the top half of the uterus. It's always measured in this ventral part. And these are all that, we're not going to go through these. All I'm letting you know is there is data out there, very good, very accurate data for placental thickness. And here you can see months of gestation and combined thickness in millimeters, but you can see my sort of little rule of thumb. If you start getting it much above 10 millimeters, i.e. a centimeter, it's too thick. But you can record all this data if you want, but that's way more than we're going to need. Here's a couple of examples of it. Look, This was a mare, 310 days of gestation. We were a little bit late on this. I mean, we felt we were very lucky to get on top of this. Look, the thickness is 16.3 millimeters. Raging placentitis in this mare. We put her on a quite high dose of antibiotics, progesterone, aspirin. If they've got plenty, if they're prepared to spend a lot of money, we put them on a drug called Trental pentoxifylline, which improves the blood supply to the placenta. And just within 7 days, you can see we'd got that thickness down to 13.8. And she, in the end, went on to deliver a live foal.
How long after the treatment?
7 days, that was. Within 7 days, we'd got that placenta. The foal, I think she foaled at term, to be quite honest, something like 335 days. So we kept her on it until then. And, you know, these are these nasty placentas. And this is the point, that a little bit the same point with the older mare. There are some very experienced repro vets who say, really, you shouldn't overtreat a placentitis. If the mare's really having that much of a problem, maybe let it come out. I think it's difficult to know for sure. Look at this, look at that infolding. This is tremendously thick. This mare has actually undergone placental separation. And sometimes you see that little mucus plug, which is quite a nice thing to see. I think it lets you know that the placenta is doing its job of keeping everything nice and safe. I mean, if you see this, look what's happening. I mean, this is separate, this is over. Not a scan by us, this was a mare. It was running a lot of milk, so the owner calls us to go and have a look. We do an ultrasound scan, and you know, I couldn't see there was twins in it at that stage. It's very, very difficult. This mare was about at term, I think. But I mean, this isn't, you can see, normally they talk about this combined thickness, but here, look, it's split. That isn't the amnion, that's the allantochorion has come off the lining of the uterus. And this has occurred, the foal's dead, effectively. It's very rare, actually. It's quite unusual for a mare to even take 24 hours to abort a dead foal. So it's quite unusual to see that, really. And just sometimes, I just get a bit nervous. Don't mix it up with the amnion. Sometimes you can see a thickened amnion as well. Transabdominal ultrasound, as I say, I think it might be something you want to refer the mares for, and I wouldn't get... Have you seen anyone had a mare with transab ultrasound? It's something we do a little bit, but we've even sort of stopped running it as a course now, because we've just have found that transrectal approach is much better for us. Yes, I think so. I think you're in a lot of trouble. Yes, I mean, but not many people have the mare routinely ultrasounded. The theory is the placental thickness increasing is your first sign. If you wait till you see a discharge, even if it's just a small one, it's gone beyond that. We do it once a month from the 5th day of gestation. And it's relatively straightforward. The other way, which is sort of the way of, and it's actually Angus McKinnon who came up with this idea, is if you think you've a mare at risk for it, the first 5 days of each month after 5 days of gestation, you just put it on 5 days of oral TMPS, which the theory is you're just knocking back that infection. You know, a little bit the worry of these placentitis mares is you're just not going to get a good... Are you treating, do you treat many, or what's the... Are you? Yes. But have you embarked on treating them?
As I said to you earlier, I mean, what the problem is, they're on the antibiotics every month for the entire pregnancy.
Yeah. And that's quite expensive, isn't it?
People would tell you they do it 2 days a week,
Do they? I mean, yeah, it's a little bit the same as when you take them off the Regulate. So, you know, I kind of pose that questions there. I mean, you're facing three challenges with a placentitis. You've got to contain the infection that's in there. You've already got an inflammation going on as well. And inflammation stirs the uterus up. It makes it very active. And a very active uterus is more prone to chuck the foal out. So you have a bit of a set of symptoms to try and deal with. And we don't know really what bacteria it'll be. We can have a guess, and in time we'll find out. Treating them early, as we were talking about there, ideally, you know, before you've got a raging discharge, maybe before you've even got running milk, maybe before you've got udder swelling. And then you have the eternal question, for how long are you going to treat these mares? You know, are you going to treat them all the way till the foal? You can monitor them with ultrasound. You know, some people say give them on non-steroidals for a week and then stop. Others say you better keep them on till term. It's a little bit the same as you had with the Regulate. We put them on progesterone. I think two things: not so much for the risk of them aborting through low levels, because it doesn't really need it in terms of maintaining pregnancy. We're using altrenogest here because it settles the uterus down. I don't know if you know, progesterone has quite a marked ability to cause what they call uterine quiescence. And then you've got these other drugs. You've got, I don't use any tocolytic drugs, clenbuterol or isoxaprine. We will use some anti-inflammatories. We'll certainly use flunixin. If money's no object, we'll use pentoxifylline, but it's very expensive. A pretty good version, aspirin, is nearly as good as pentoxifylline and about 1/10 of the price. And most of the work, I think, it's almost become known in the sort of veterinary literature. The Florida Vet School did most of the work on this treatment, and we kind of follow their recommendations. So I'm minded we're coming up to time there. I'm sorry if we didn't quite get through everything which we had, but I hope I admire your stamina for... Sorry?
Is that a real mark?
Yes, yes. So we stole it for a question thing. Yeah, I thought it was quite funny, really. Thank you for your sort of longevity in lasting through the time. I don't know whether any wine is left through there. And if any of you have any questions, I'm either happy to answer them now, or if you ever want to email me in or whatever.
Can I ask?
Yeah, sure. Well, we'll go with their one and then here.
Doctor, we've
No.
dealt at length of the fertility of the man and her reproductive organs. I just want to touch on the stallion.
Yeah, we could do. Yeah, we have 5 minutes on the stallion.
There seems to be new science in humans putting more emphasis onto the age of the males and problems occurring with the older males. Is that pertinent to us? Is that why is it that we see a tendency that the older stallions tend to become less successful later in their careers?
Yeah, I think there is an aging defect with sperm, but I don't think it's particularly marked in the stallion. I think older stallions can get... you have to pin down what the problem would be. If it's, you know, some older stallions seem to go off covering, which might be a combination of they might get fed up of it, they might have a non-reproductive issue, they might have a little bit of pain in there or something. I mean, we quite often have our older stallions on a gram of bute twice a day because we just felt they were a little reluctant to jump up and cover otherwise. I think older stallions are more prone to a thing called blocked ampullae. I don't know if you ever had that, which is a very common problem in stallions. It would almost be the first thing, if somebody tells me a stallion stopped getting his mares in foals, I would take an ejaculate and I bet I'd see plenty of sperm, but they'd all be dead because his ampullary glands are blocked, and we can free those relatively easily with a little bit of oxytocin. Very straightforward way of dealing with that. And I think older stallions are more prone to that. And then, of course, we can just get a reduction in sperm numbers. And I think most of the ways I've dealt with older testosterone and things like that are generally a very bad idea to give in stallions. It's tempting, and You know, I've been involved in stallion fertility things for insurance all over the world, and the owners of the stallions all want to give them a blast of testosterone, and that's probably about the worst thing you can do. I think the main thing with an older stallion is you begin to manage them. You check how much sperm they're producing, and if they are producing, if you're dropping down in numbers and you're getting close to the edge, you've got to remember that you can't cover 3 times a day with those stallions, because you're only maybe chucking out 1 billion, 1.5, 2 billion sperm, and if you start covering 3 times a day, you're probably dropping down to below your inseminate, you know, this magical number of 500 million. So I think generally we manage older stallions by being fussier about covering. There we do try and go closer to ovulation. You know, we talked about the mare and we're saying, you know, if you have a fluidy mare, move away from going bang on top of ovulation. But of course that goes out the window if you have a stallion where the sperm isn't going to live very long. There you've got to just have your... We manage those quite often. Well, there's only 1 cover a day for those boys, and you've got to just pick the absolute plum mares. I don't know if any of you had to deal with older stallions, or... It's generally you just have to manage expectations. I think you have to cover less with them and be more accurate with follicle control, unless they have got one of those specific problems, which the commonest things for me have been just they're a little bit sore, a bit uncomfortable, so we put them on a gram of bute twice a day, and a blocked ampullae, which you'll generally tell that off a semen sample, because there'll be plenty of sperm numbers, they'll just be maybe 90% dead, and they're not going anywhere.
We've got a problem, we're not allowed to use bute anymore.
Yes, I suppose I'd use probably Finidine. It'd just be a bit more expensive, really. Yeah, we could do this. We'll have to do the stallion next time. The stallion's less of a... Even veterinarians who do a lot of repro work, it tends to be very specialised, the stallion. And generally, stallions which have a fertility problem in an area where I'm nearby, I never get asked to look at those, and then I'll get shipped all over the world to look. It's the way stallions work. They don't want the local fellas having a look at the stallion. Of all branches of equine reproduction, it's the most secretive I've come across. We're sort of sworn to signing things when we go look at these.
Yeah, but they'd rather blame the mare owners.
Yeah, yes. I think the difficulty is that once something comes out about a stallion, it's quite serious, really. So I can understand it needs carefully looking at. But there's often not a magic bullet to stallion problems. It tends to end up a managing thing. And unless you've taken a semen, you know, just because we have no AI in the thoroughbred, it doesn't mean we can't evaluate a semen sample. I mean, you can't... I felt I couldn't go to do a fertility exam on a stallion, whether it be for insurance or whether it be to investigate a problem. We had to get a semen sample off him. And most thoroughbred stallions, if you've got a mare in heat, you can get a semen sample. The difficulty was, out of the season, if people call me, if there's no mare in heat, we're not going to get a semen sample. And some people's definition of a mare in heat wasn't mine, because I had to stand behind them when they were doing it. And no matter how times... over the year, I used to say to them, yes, I'll come and do a semen event. Have you got a mare which will be standing for me to jump the stallion on? Yes, doc, we have. You get there, this thing is kicking 7 bells out of you, and it's over. It's not going to happen. So, yeah, that's the commonest thing with stallions, I think. I mean, that's dealt with stallion fertility in 5 minutes, which is a bit of an underdo, but we'll have to do stallion next time.
I'm going to be unfair and ask you a second question.
That's okay.
Young stallions or horses that come off the track.
Yep.
To what degree can the racing treatments?
Oh yeah, I think an awful lot, and I think again whether it's I mean, are we meaning stallions which are being given steroids or just the
whatever they've been given in training?
Yeah, it is a worry, is that, and I think it is a problem, and I think it's. If they're being given something long-lasting which is affecting them, well, there's nothing much you can do about that. If they're having problems because of the racetrack conditioning environment, but they haven't actually been physically or injected with anything, I think it's a matter of time. And it's one area, I'm not a most particularly patient person, but it's one area with a stallion. I think you just have to spend so much time with them of trying to get them out of that race environment and into the environment of covering them. I don't know, you guys that have taken first season sires, and I suppose I only get involved when there's problems with them. Do you find them easy to...
Depending on which trainer they come from.
Is it? So does that mean how different trainers handle them, or how different trainers administer things to them?
Administer things
Once
to
again,
them.
that's a big secret.
That's a secret. It's the same secret about the fertility of stallions. But what do you do if you've got a stallion that you know is not very fertile, but you want to use it? How would you, besides sending a mare that's easy to get in foal, how would you manage that?
Well, I think if you've exhausted all avenues with a stallion, I would like to think, it's one of the examples when I think the sports horse industry perhaps is a little bit more open with it. If you have stallions which have low sperm numbers, for argument's sake, so are going to be subfertile, if I think you're honest and give the information, I think people again make the choice. Because if your stallion's going to ejaculate maybe just 1 billion sperm each time, if you cover 3 mares with him, you won't get any in foal. You're far better to say, right, this old boy now is only putting out enough sperm, but we can only take 1 mare a day. And I think if you're honest like that, breeders can then make a decision when you've been given all the information. There's no problem with a stallion only producing that number, because they're perfectly fertile, as long as he's not going to share it. It's the same as, we got some clients who when they walk the stallion, if the stallion took 20 minutes, 30 minutes to cover the mare, it's a phenomenal pain in the neck for the stallion stud, but they would always come back and say, oh, John, this mare's not going to be in foal. They took half an hour to cover the mare. I always say to them, as long as the cover was okay at the end of that half hour, it's fine. If the stallion has prated about for half an hour, but then decides, well, you know what, I'm going to go ahead and cover this mare, that doesn't matter at all. Totally different thing if the stallion, doesn't matter if the stallion pretends he's covered it in 2 minutes, that's no good. But if the stallion takes half an hour, but as long as they cover the mare, then it's okay. And I think if people are, you just have to tell people, if your stallion's producing lower sperm numbers, well, you've just got to front up about that.
But they don't.
Well, but the risk is that if you will end up, you won't get any in foal, and ultimately that will bite into the business. But there's so many reasons why a mare mightn't be in foal. It's very difficult to apportion it one way or the other, and I certainly wouldn't be brave enough. I'm looking at a mixed group of stallion and mare owners, so I'm on the fence, and I'm going to be staying on it. So I'm not going to come down. Okay, guys, I think I'm keen to get you all away on time. So.